About 3 years ago, I went in to see Dr. Nguyen for my annual physical, and my PSA had gone up from the previous year. It wasn't considered excessive, but he didn't like the fact that it had jumped some, and so he referred me to the urology clinic.
We kind of had a discussion, do we monitor it or do we get it, just a second opinion, because it never hurts to discuss these labs further, and both of us elected to say, hey, these are abnormal numbers outside the range, let's go ahead and just take a look at it and start the process, and that's how we kind of initiated that.
When he referred me to the urology clinic, I didn't think much of it. I thought, well, I'll just follow through on this and it won't be anything.
It's a blood marker that looks at kind of the activity of the prostate. That's why it's a little bit difficult, because it's a screening tool and it can be affected by various things in your blood.
It turns out that I had cancer on the prostate. I had a few months of pretty intense chemotherapy, and then a scan showed no trace of cancer. So then they did a cystectomy. The surgery went as well as it could, and so did the healing process.
And once the treatment happens, I think that's a big component that all primary care providers play a role in, is that we're kind of your quarterback to coordinate everything.
About a year and a half afterwards, the urologist asked for a follow-up scan, and all that area around the prostate was fine, but it showed cancer in the bladder. Some
individuals can have a form of prostate cancer that just slowly grows and only stays limited to the prostate. You may have an aggressive form.
It all goes back to 3 years ago, because if Dr. Nguyen hadn't sent me to see the urologist then, who knows, both could have been much worse than they were. So I was thankful that he sent me early. Knowing is kind of a fearful thing for patients, and I would say the same, knowing their blood work, knowing, prostate cancer screening, colonoscopies, I think the fear of possibly catching something, but the idea is you're catching it early enough usually than you would have, because if you wait, then we have a problem we have to fix later, or maybe too late, or maybe too complex. Well, just go. Get that annual physical. It's a relatively easy thing to do, and the way the blood tests are now, they can turn up a lot of things through a simple blood test. I mean, to really know that I made an impact in somebody's life, and that's kind of why I am a provider, is to be able to make this change, but also just to take care of people. The care with Dr. Nguyen has been just outstanding. I'm not an overly dramatic person, but might not be here today. Dr. Nguyen made what even he said was an early referral, but I'm so glad for it.